I'm Ros Wade from the Centre for Reviews and Dissemination at the University of York. I'm the lead author of this summary of a systematic review of interventions for the management of hyperhidrosis, published in the British Journal of Dermatology. This review was part of a larger project published by the National Institute for Health Research. There is significant variation in the treatment of primary hyperhidrosis in secondary care and uncertainty regarding optimal patient management. Therefore, we undertook a systematic review of the clinical effectiveness and safety of treatments for hyperhidrosis. We searched 15 electronic databases to identify relevant studies. The quality of trials was assessed using a modified version of the Cochrane risk of bias tool. Results were pulled in pairwise meta-analyses where appropriate, otherwise results were summarised in a narrative synthesis. Clinical and patient advisors contributed to the interpretation of the results. 50 studies were included in the review, 32 randomised controlled trials, 17 non-randomised trials and 1 large case series. Most of the included studies were small, to high risk of bias and poorly reported. The interventions assessed were iontophoresis, botulinum toxin injections, anticholinergic medications, curettage and newer energy-based technologies that damage the sweat gland. Overall, there was very low quality but consistent evidence suggesting a short-term beneficial effect of tap water iontophoresis in the treatment of Palmer hyperhidrosis. No serious adverse events were reported. Botulinum toxin injection was the most frequently studied intervention. Meta-analysis was undertaken comparing botulinum toxin with placebo for axillary hyperhidrosis. There was a large and clinically significant effect of botulinum toxin injections in the short and medium term. No serious adverse events were reported. The most common adverse event was injection site pain. The evidence for anticholinergic medications was limited but suggested short-term benefits, although oral anticholinergics caused dry mouth as an adverse event. Studies evaluating curettage and newer energy-based technologies that damage the sweat gland were all at a high risk of bias, and there was insufficient evidence regarding their safety and effectiveness to draw conclusions. Overall, the evidence for the effectiveness and safety of treatments for hyperhidrosis is limited, and few firm conclusions can be drawn. However, there's moderate quality evidence to support the use of botulinum toxin injections for axillary hyperhidrosis in clinical practice. Whilst the evidence for iontophoresis is very low quality, it's consistent, suggesting that there's a short-term beneficial effect of tap water iontophoresis in the treatment of Palmer hyperhidrosis. Additional results, as well as cost effectiveness and value of information analysis, are presented in the full report published by the National Institute for Health Research.